3, which is health insurance, and it was basically just a broad array. They just covered almost all aspects of health insurance. So, start with a little background. Health insurance became available in the U.S. in 1929, and it started from a man in Texas who, a hospital owner. He had some hospitals, and he was giving school teachers to cover all their kids in case something in school happened. For 50 cents a month, he'd give them some 20-day care, up to 20 days. Then in the 30s, coverage expanded to hospital, surgical, and medical services for anyone. And by the 50s, we had extensive treatment, which would be long-term, like if you had an illness that required a lot of attention and you had to be in the hospital for a long time. And then in going Medicare was established. I'll talk about that later. And then in the 70s, we had HMOs and PPOs, and we'll get into that later too. So I'm going to break out, watch a little video here.
Today's topic, how does health insurance work? The simple answer is, it's about economy of scale. Since time began, mankind has found safety in numbers. Health coverage is no different. When you sign up for coverage, you join a group of other people to combine your healthcare purchasing power. Your insurer covers the whole group rather than individuals, so everyone shares the cost of staying healthy. It's a lot like an auto insurance company that collects premiums from its customers, then uses that pool of money to pay accident claims when a customer has a wreck. Here's an example. Gary's a healthy guy, but it's his first time skiing. Moments after stepping off the lift, he plummets down the wrong slope and hits a tree. Then 5 more trees. Then he slides over the edge of a small cliff and is promptly hit by a falling safe. Just then, his wife calls to inform him she's about to deliver twins. Gary's about to be buried under a lot more than snow, because costly medical events like these can be devastating without health insurance. His broken leg and concussion can cost thousands to treat, and depending on the circumstances, the birth of his twins could cost anywhere from a few thousand to 100,000 or more. Fortunately, Gary has health insurance. Remember that group we spoke of? Since the costs are spread out over everyone, the people in Gary's group are actually helping to offset his costs. Gary's going to pay a lot less to treat his injuries and deliver his kids because his insurer is betting that the money the group pays in will offset the total costs of their health expenditures for the year. In a sense, the healthy people in the group help pay the costs when someone is sick or injured, knowing that the same help will be there when they need it. So instead of paying thousands of dollars, Gary's out-of-pocket costs are minimal. He's only responsible for his copay and his deductible, which vary by insurer. So to sum it up, health coverage reduces your risk of financial disaster because your health costs are spread across a large group of people, and the healthy people help pay for the sick. So now you know. Until next time, stay smart and stay healthy.
Alright, so that summed up insurance pretty much. But they talked about group versus individual, and right there they were touching on group-based, which is most common. You're going to get it from like wherever you work or whatever. So basically it's offered through employers. You're going to pay your deductibles and premiums, and it'll even out because not everyone's going to need insurance and then so on. But they also touched on you can get individual insurance, which you're paying everything, and that'd be a lot more expensive. So probably not worth doing just that. Basic versus major health coverage. Right here, it's basic is what most people pay for. You're just going to get your basic hospital and medical coverage and your daily visits, that here and there. It will cover maternity care too. So I don't know, that's about it. And then the major is just if you're like you got cancer, you're really sick, you're gonna, if you tend to be sick a lot, you're gonna want to get major coverage, which just helps with prolonged illness and serious injuries. Contract provisions. They talked about, they got into like the actual signing of health insurance, like contracts and stuff, and they just wanted you to be aware of some key terms. Like waiting periods are just, if you sign for your health insurance, there's usually a 3-month, 4-month period before it becomes effective. So if you get sick in that amount of time, they don't have to cover that. So you're just supposed to be aware of your how much time you have in between. And then pre-existing illness goes along with that, which would be if you did get sick before you had coverage, they don't have to cover you for that. Exclusions, just just means like dental vision. Those usually don't get covered, and those are separate kinds of health insurances usually. And then dependent coverage is when you have a family and you have kids. So your dependents would be getting on your insurance too. Types of plans. There are two main families of healthcare, and that's indemnity and managed care. And indemnity is like what we think of when we think of health insurance, like compensation for like loss or injury or whatever. And there's fee for service and fixed dollars we'll get into in a minute. And then managed care is like your employer will pay for like a network of people you can go to. Like you could go to like this x-ray center or this health professional. Like you can go to any one of their prescribed people. And it's the managed care is usually for like non-emergencies, like plastic surgeons. If you want to go in and do that, they'll cover that kind of stuff for you. That's what managed care stuff is. And we'll get into those too a little bit. But fee for service, we're going to start with the indemnity ones. Fee for service is most common what you're going to think of. You're going to go to the doctor, you're going to get your service done, then they're going to bill you, where they're going to bill for every time you go in there, whatever you get done. So you're just going to pay your premium, your deductibles, and that's pretty much what we think of when we think of healthcare. And then fixed dollar plans. These are more of a sketchy way to do stuff. They say they're typically sold by mail or internet, which that doesn't sound very secure to me. I don't know. But every time you go to the hospital, they say they will pay for your visit. Like they'll give you $100 to go to the hospital, they'll give you $50 to go to the hospital, or do whatever. So it's not really a good thing. It's an alternative to getting basic insurance. Like if you're really poor, a lot of people, if they're struggling, maybe do stuff like this. But it really isn't good for it. And it's a bad investment for dread diseases. And when I say dread, they're talking about like cancers and like serious like fatal illnesses. And in a lot of these plans, they said they would just like duplicate some of the things that you're benefiting, some of the benefits you're getting, they'll just duplicate them and they'll be in the fine print to where it's just not good for you. It's just, they just say it's a terrible investment, and fixed dollar plans usually aren't good things to get your hands on. And then the managed care ones, the ones that are optional, or not optional, like the company's going to pay for. The first one is HMO, and that's a health maintenance organization. And you're going to pay your monthly premiums, and they'll tie you to go to the providers they give you. The law nowadays requires you to, if you have employees, if you have 25 or more employees, you have to offer this type of care. In 2009, there were about 75.3 million Americans enrolled in these. And this and the PPOs I'm going to get into next, the really only difference is this one, you have to have a primary care physician first, and then you can still go to these other designated people that your company offers. And then when we get a preferred provider, this, basically the only difference from the other one is you don't have to have a primary care physician. And you can go, really the only difference is you have to pay a higher fee to go out of that network. The other one, you can't go out of your network, or else they're not going to cover anything. In PPOs, they will still cover you if you go out of your network, but you're going to have to pay a lot higher fee. And in this one also, you don't need a referral from your primary care physician because you don't have one. But those are the big differences in those. And then a point of service plan is basically the two mixed. Your primary physician provides basic care, and then you can authorize referrals there. And then like in the HMO, subscribers are going to pay the co-payments and deductibles to your network providers. But in PPO, just like PPOs, you can pay higher rates for out-of-network stuff too. And we're going to watch another little video here quick.
So you want to buy health insurance. You're searching for the best plan. Excellent. If you are in your early 20s, mid-20s, early 30s, navigating through the process can be confusing. You don't really know what the best plan is because you don't do this for a living. So you're going to entrust yourself with someone else to find the best plan and the best price. Let me give you some things to always keep in mind with health insurance. You know, health insurance is in the news. Politicians are painting this terrible picture on how expensive it is. Yeah, there are expensive plans, and typically those plans are so expensive because people are buying things they don't need. When you look at health insurance, you need to ask yourself the big picture. What do you want the plan to do for yourself? I ask all my customers, do you want it to cover the sniffles, or do you want a plan that'll cover a $50,000 claim? Could a $50,000 claim really have an impact on your finances? Yeah, it would definitely for me. So some questions you need to ask yourself. Where can you trim fat on a health insurance policy and drive the rate down? Because price is going to be the most important thing. You want good coverage over here, but if you can't afford it, you're not going to keep it. First thing, choose a high deductible. And I'm not talking a $500 or $1,000. Bump it up. Go to a $2,500 or a $3,500 deductible. The higher your deductible, the lower your price. 2, if you have an opportunity to carve out doctor copays, do it. Ask yourself, how many times do you go to the doctor? Typically, people go once or twice. Perfect. Insure yourself, allow those charges to go towards your deductible, and you can lower your price probably $100 a month. And then 3, when you're looking at a health insurance plan, make sure you're working with someone who has been in the business and has a variety of products. Not one plan is going to fit everybody's needs. You might have high blood pressure. You might be a little under tall. You might have this, you might have that. You need to work with an independent agent who doesn't have one, but might have 4 national carriers. We do this for a living. We love what we do, but we know that if you don't have a plan that's going to fit your budget, you're not going to keep it. And then the worst possible scenario is that you leave without any coverage at all. Give us a call, check out our website, look at some prices, let's navigate the
So she was just touching on, you know, it's important on what you're getting and knowing what to do. So when you're choosing a plan, it's going to vary from company to company, so you're going to want to really look at the details and know what you're getting. If you have a family, you're probably going to want different coverage than if you're a single man and don't really have anything to depend on you. So some other sites that they were talking about, healthinsuраnceinfo.net, healthcare.gov, and weissratings.com. They all have good information if you're looking into getting some health care for you. So aside from that, they talked about some other alternatives to healthcare. One of them was concierge medicine, and it's fairly uncommon. This is where physicians will exclusively give exclusive primary care to a limited number of patients. So one doctor they'll give you house calls. They'll like pretty much tailor to all your needs. A lot of elderly people use it. Usually 600 patients per physician, they were saying. In 2010, they said there were probably 5,000 of these physicians in the U.S., so it's fairly uncommon, but I guess it's still out there. Medicare was another huge topic they were talking about. And Medicare is for anyone that's 65 or older. Anyone under 65 with certain disabilities, pretty serious disabilities, can claim it too. And then anyone with kidney failure, basically requiring dialysis, can have it too. But when you get Medicare, it comes in, there's 2 types of it, Part A and Part B. And Part A is what, that's like basically hospitality, and you get your inpatient hospital care, nursing facilities. And then Part B is like going to the doctor, getting ambulance or medical fees, medical supplies. But when you get it, Part A, you don't have to pay for. That's paid by Social Security taxes. So that's what basically all of us are paying for. And then if you have Medicare, Part B is a monthly subscription they have to pay for. But once you enroll, you're enrolled in both of them. But once you get your Medicare card, you can opt out of Part B if you don't want it, and then just have Part A. And then there's also the Medicare Advantage plan, and they list those as Part C and Part D. And basically Part C just includes like vision, dental, hearing, like normal stuff that doesn't come in a healthcare plan. And Part D covers like your drug costs, like prescriptions and pills and stuff. So you can also get on the Medicare Advantage plan if you want, but you don't have to. And some government-sponsored programs, they talked about these a little bit in the book, but didn't touch on them a lot. They were talking about the Veterans Health Administration, which services veterans who have actively served. And then they got into the military health system. It gives care to members of armed forces if they're overseas and stuff. And the Indian Health Service, it's for Native Americans, Alaskans, people like that. And then the Children's Health Insurance Program, basically for adolescents, infants, anyone under 19 can qualify for that. And then the last thing they touched on was long-term care, which basically we think of as like nursing homes, getting an in-home nurse. This is usually a really expensive thing to get. They're giving us statistics, 46% of Americans over 65 usually have some sort of long-term care. And it's an annual cost of over $70,000, so it's extremely expensive and not everyone can afford it, but what are you gonna do when you're old? I mean, you gotta do something, so. Alright, I also got a little word search we're gonna do, so. Alright, well, while most of you guys are finishing up, I guess all I really want out of this was for you to understand what healthcare is, health insurance, and just want you to understand what you're buying, and read the fine print, really know what you're getting. Make sure you're covering everything you need to.